Bonjour. Alors, bonjour à
Good afternoon, everybody. Welcome to this press conference with Premier François Legault, Health Minister Christian Dubé, and the Director of Public Health, Horacio Arruda. Mr. Premier, the floor is yours. Hello, everybody. I want to begin, well, tomorrow, as of tomorrow, we will commemorate Veterans Day, and I met people responsible for Branch 265 of Quebec who gave me a poppy. And of course, we want as many Quebecers as possible to wear the poppy up until the 11th of November to remember the 11th of November, Remembrance Day in 1918, the end of the First World War. Perhaps it's an opportunity to compare the sacrifices that we are asking of citizens. You know, currently, restaurants, gyms, theaters are closed. We are asking citizens to make sacrifices. But perhaps we have to remember the sacrifices that we asked past generations to make in order to protect our rights and our democracy. I mean, there were greater sacrifices than what we're asking for now. So perhaps it's a good time to take this opportunity to remember this. Today, we've got 1,034 new cases. So for the past month, we've been on the same plateau, around 1,000 cases per day. It's high, but at the same time, it's under control. And I know that it's a slim consolation to remember and to see what's going on elsewhere. But when we look at what is happening throughout the world, well, let's look in the U.S., for instance. All things being equal, yesterday they had 80,000 new cases. That's twice as many per capita than in Quebec. When we look in France, our cousins in France, 36,000 new cases today. That's 5 times greater than what we have here. And when we look in the world, for the first time, we have surpassed the 500,000 new cases. So 500,000 new cases in 24 hours throughout the world. So the situation is getting worse throughout the planet. And if we come back to France, the situation is we can see what can happen if we lose control, especially when it comes to hospitalizations. In France, it's almost dramatic. They've got more than 20,000 people in hospitals. So 5 times more than what we have here. It's as if instead of having 500 in hospital, we had 2,500 in hospitals. We can imagine the impact that this would have on other services that are provided in the health network. When we look at the measures that are announced, yesterday, President Macron announced that as of tomorrow morning, restaurants, bars, gyms would be closed. But he went even further than we did. All shops that are not essential, kind of like what we did in the spring, will be closed in France. Why am I mentioning this? Well, because, first of all Quebecers must be aware of the fact that the situation is critical. The world is not going in the right direction as it pertains to COVID-19. And the measures that we have implemented are not greater in Quebec than elsewhere in the world. And in some cases, it's the opposite. And I can understand that there are some people who are not happy. There are some people who are frustrated. For example, restaurant owners, gym owners, clients. What they tell us is, I respected all the required measures, and you are shutting me down again. And what we must understand is that the problem it doesn't lie with the owners. And there was nothing wrong with the efforts that they deployed. It's just that currently we have no choice. If we don't want to see an explosion, as we're seeing in other countries like in France, we have to prevent. And there are some owners who say, well, there was no outbreak in my restaurant. But what we must understand is that before going to the restaurant, before stepping into a restaurant, after we leave the restaurant, there's always a risk of contact. And I think that, and myself first, it's not yet natural to me, even after 8 months, to always stay 2 meters away from others. So unconsciously, without any bad faith whatsoever, there are some people who will go meet a friend at the door of the restaurant, and they will get closer to them at less than 2 meters. So what we're trying to do is we're trying to reduce contacts, but also reduce the risks of contacts. And that is why we have implemented the measures that we have. I'll finish by telling you, yes, we have put in place, we have asked for sacrifices, we have put in place some measures. We are asking people, and it's not pleasant to not go to the restaurant or to not go to the gym, but we must look at the consequences if we don't implement these measures. Today, we still have 25 new deaths, and that is why we are asking for these sacrifices. I know that it's difficult, what we're asking you to do. But the only remedy that we have is to help each other out, to support each other, and to work together so that we can get out of this together. It is together that we will succeed in getting through this. And we are all together in this, Quebecers more than ever.
Good afternoon, everyone. The situation in Quebec remains stable. The average number of new cases remains around 1,000 per day. Elsewhere in the world, the situation is deteriorating. Not easy, this one. And critical, that's easier. So in Europe, in the United States, the number of cases is increasing very fast. It shows us how critical the situation is and how much all of our efforts over the past weeks have helped us. For now, we've avoided the worst. But we see that if we get too confident, the virus will come back stronger. That's why we're keeping the restrictions in red zones. So I know it's difficult for a lot of people, but we must continue to help each other. We're all in this together. Thank you.
Merci, Monsieur le Premier ministre. Nous avons...
Thank you, Mr. Premier. We will begin the question period. Hello, gentlemen. Mr. Dubé, I'll start with you. The attack that we saw in the center-west of Montreal, do you expect other attacks on the hospital system in Quebec? And what effects could this have on services to citizens? Well, first of all, I would say that the situation can evolve quite quickly. I'll take a moment to give you an idea of what we understand so far. There were some attacks, more particularly yesterday, on the Centre-Ouest CIUS, and quickly our teams realized that there were these attacks, and in order to protect the data, the hospital data of the population, the decision was made to close down the systems, because the best thing to do, the best protection, when we realize that the cyber attack was significant, and from what we understand, and I'm telling you that now we are looking at all of this, it's not just in Quebec. The attack was probably beyond our borders. And what I understand as well is that perhaps it's not just at the CIUS Centre-Ouest. I heard this morning from the people with whom we're speaking that there might be other centers that were also impacted. But once again, the approach that we're taking is to protect the personal data. Now, what that means is that it's going to, and I'll give you an example here, we're protecting personal data, we're shutting down the system, but there will be some appointments that will have to be delayed because now the CLSC, for example, for this use, can no longer have access to the system to go check appointments. But we think that it's a small sacrifice. We put all of our expertise, not only at the Ministry of Health, and I'll finish with this, with our new group that is steered by Ministre Kerr, the cyber security group, to see in collaboration with the RCMP all the work that can be done in order to see if it goes beyond Quebec. But I want to reassure the population that up until now, our understanding is we've decided to shut down the systems to make sure that there is a control of our data, and we are working with Microsoft, amongst others, to look at the impact that it could have and how we can keep the situation under control. Thank you. Mr. Legault, as to the sanctions that are recommended by the Ethics Commissioner with the Minister of the Economy. Now, with what's been reported, is it a violation that could be forgiven, or will you ask your caucus to vote against a sanction? First of all, I have full confidence in the Ethics Commissioner. It's important to mention that. And the Minister of the Economy was imprudent. He should not have met a friend with projects, and he admitted earlier during a press conference that he was not prudent. Now, contrary to the Liberals who had voted against the report of the Ethics Commissioner on Pierre Paradis, I will recommend to my caucus and myself personally, I will vote for a report from the Ethics Commissioner. Now, I still want to come back to the file itself. The Minister of the Economy met a friend who came to present 3 projects, 2 projects with businesses and 1 with a municipality. The 2 projects with the businesses were refused. The project with the municipality was accepted, but by another minister. It wasn't the Minister of the Economy who handled this. And what I want to say, because I've spoken with him, is that he acted in good faith. Perhaps it was a lack of experience, I am telling you, and I told him it wasn't a good idea to meet his friend. But the Minister of the Economy, he said, well, the more projects we have, the happier I am. I came into politics so that we can have an explosion of projects in Quebec. So he said, well, even if it's a friend or not a friend, all projects will be evaluated on their merit. And the Ethics Commissioner confirmed that there was never any question that he would have any financial advantage or any financial benefits for the Minister of the Economy in this story. That's important to understand. So I think that he acted in good faith by saying, bring projects to me. And I think that now he's learned his lesson. I think that when we speak about the consequences of things, I think he's already felt the consequence. The fact that we're talking about this in the media, I think that is the worst reprimand, to find our own names in the papers. I think he learned his lesson, and I believe that, for me, the case is closed. Question? So, Mr. Premier, we are to understand that you're not going to ask him to resign or to leave his place to somebody else. You are defending him. Mr. Fitzgibbon will remain Minister of the Economy. What I'm saying is that he was imprudent. He should not have met his friend, because even if his friend had wonderful projects for Quebec, well, it's quite obvious that it's easier with for a friend to meet a minister than somebody who's not a friend. So there's a problem of equity. It happened at the beginning of his mandate. I think that, he had a wonderful career in the private sector, and now he wanted to serve the population, serve Quebec, and he acted in good faith. I'm not saying that he did things correctly. He should not have met his friend. He was imprudent. He admitted that he was not cautious enough, but he acted in good faith. And in my opinion, I'm just going to turn the page. Mr. Dubé, right now, there's a general director in the Montérégie who's been suspended. Is it accountability now for the first time in the pandemic? Well, listen, first of all, I want people to understand that it's a decision that was made by the CEO of Montérégie Centre. And I think that after, if I understand the situation correctly, there was an analysis done of what was done, specifically at the CHSLD in St. Croix. And after having analyzed the facts, a decision was made by the minister responsible, by the local person that we have put in place. And this decision was made in a context, Mr. Laforêt, so as to hold this person accountable, and I will respect the CEO's decision. Question? I'm sorry, he's not using the microphone. You've heard what Anthony Fauci in the U.S. has said, who's talking about a return to normal by the beginning of 2022. So in other words, we have to have a vaccine and vaccinate people, etc. Do you have the same reading of the situation for Quebec? I hope it's not going to be exactly the same. I hope it'll be a little bit earlier, given the virus that's circulating here. So obviously, all of this will depend, in my opinion, on the vaccine that we will have and to what extent the vaccine will be effective in preventing cases and complications, particularly with more vulnerable people and health workers that we want to protect, of course. But I have the impression as well that we will have to redefine, we'll have to have, look at how we will function in a society where we can tolerate a certain level of cases without it being detrimental to everything else. But when it comes to mask wearing, sanitary measures and distancing measures, I think that we will have to live with that for quite a while. However, I don't think that we'll be able to stay confined, totally confined, or come back to a total confinement or a total lockdown, as like France is doing, for a very long period of time, because there are some significant negative impacts. Protecting our schools is an important element because it's protecting the education of our young people. So missing 3 months of school is one thing, but missing 2 to 3 years, particularly for the most vulnerable, is going to be important. So we have to put this in perspective and do as much as we can to decrease the period of time itself. But the vaccine, in my opinion, or therapy will be key elements. So I understand that for you, the measures will stay in place until around 2022. Are there restrictions, certain restrictions, that will remain in place as well? I would say that all that we'll do is what will allow, if society functioned normally, with social distancing of 2 meters and a face covering and all of that, we would have very low rates. But that's not the reality. So I would tell you that we will probably relearn to maintain a greater distance between people over time, as we have learned to wear the mask. The mask was not worn correctly in the beginning, but now people are wearing it better. So I think that we will get to that stability. But, it's possible that we'll have a vaccine, even in Quebec and Canada, in January or February of 2021. So I think that we have to go step by step. It's difficult to forecast, but we can't believe that everything is going to be over in June of next year. I think perhaps it's a bit too optimistic, but I think that, maybe somewhere in the middle. Question? We've seen over the past week a slow decrease, but a sustained decrease in hospitalizations. Is that good news? Or can't we really draw any conclusions? I learned to be very prudent over the past few months. I think that having stabilized, as the Premier was saying, the number of cases, at around 1,000 cases per day over the past several weeks. Well, it's normal that the effect on hospitalizations will also be stabilized. So that's the good news. And remember, when I talked to you about the study, the INS study that we publish once a week, that's what it demonstrated. If we were able to stabilize the cases, that we would have a certain stabilization in hospitalizations as well. So the model from the INS is working quite well, and I think that we must congratulate Quebecers. But I'm repeating that 500 hospitalizations is still quite high because in certain regions, like in the national capital, it hurts us. But I believe that if we want to give ourselves some latitude, some wiggle room, well, we have to go below 500 hospitalizations. And that is why we are continuing to tell Quebecers that we must respect the measures, even if we believe that we have won half the battle, stabilizing in this context. Well, we have to decrease the number of cases still. We heard this morning that there are some patients of the Institut en Santé Mentale de Québec who were deprived of basic care because there was a lack of personnel because of COVID. How is this still possible after 8 months? Was there a lack of preparation in that institute? Well, listen, we put a lot of emphasis on the CHSLDs, on the RPAs, and now we're talking about a hospital setting where we can say that we were quite protected in the first wave. And I think in the region of Quebec, we are seeing the effect of what we said, that at some point it's going to crop up, it's going to show in the hospitalizations and in the network. So we've got evidence of this now. Right away, when I saw this, I asked that we go do a verification of what truly happened, because if there were some people who were not hydrated enough, that's a serious problem. So when I heard about this, I asked the ministry to report back to me, and I should find out more in the next few hours. Question. Hello to all three of you. You've probably been made aware of the letter from 700 doctors who denounced the centralization of the network. These same doctors also submitted a report to you in June. Why is there still this code of silence in the network? And were you aware of the decisions that were refused in hospitals, these decisions that could have saved lives, and that, to the contrary, caused some deaths because we couldn't even put up barriers in a hospital, for example? I did not read the report that you're mentioning. I'd like to read it. I've asked the people from my ministry to get this report because I haven't seen it, first of all. But there's one thing that is important to say. The message from these doctors, and I read the letter like many Quebecers this morning, I want to draw a parallel between what we've done. The main criticism that we hear from these 700 doctors is to say that the reform that was put in place by the Liberals, the Barrette reform, had extremely negative effects in local management. And you saw what we did to mitigate this with the CHSLDs. We said we cannot continue to have this type of management where local expertise and local decisions cannot be made. In the example of the CHSLDs, we said we do not need to change the structure, but we must change the governance. And I think we have demonstrated how important it was to have local management in the CHSLDs. So please let me read the report that we're speaking of, because I haven't seen it yet. And once I have read it, because I've already, with my team, with the Deputy Minister, Mrs. Savoy, we've already established regular discussions with the CEOs, but also with different medical teams. So if these people have suggestions for me, and I'm repeating myself, we were not afraid to change the governance in the CHSLDs, but if we must make adjustments, for example, in hospital settings, we will make them, and I'm open to this. But the objective, and I understand why they are disappointed, this Barrette reform centralizes the decisions, and it prevents local people from being agile. What we have brought back to the CHSLD level, we've done it there, and if needed, we'll do it in other sectors. Let's talk about local governance that you mentioned in the CHSLDs, because they take the same example, and they say, well, we have found that it was important to have a local director in the CHSLDs. Why would not that be the case in a hospital? How come hospitals don't have directors? And sometimes there's one general director who's managing 3 or 4 hospitals, which is illogical. They want one director per hospital. Well, listen, I'm not going to judge us in the public square. Like I said, I understand the sense of their intervention, but I would like to read the report before I can take a position. But the principle of having a local level of influence, we're not against this, because that is what we wanted to. What's important here is that when we bring the decision-making at the local level, we also bring accountability. And you have just seen this. You saw what happened in the Montérégie. So I am ready to hear out the doctors, but we'll have to understand that the level of responsibility brings about accountability as well, and that is why I want to read in the report. Mr. Premier, I would like to talk about the deaths. We're talking about 25 today, I believe. We're talking about an average over the past few days of 17 deaths per day. There was a significant change as it pertains to the deaths with the second wave. In the first wave, 2/3 of the deaths occurred in the CHSLDs, whereas today, a big proportion is people who are at home. How do you explain the situation? Are you worried that the health of many people is getting worse at home? When we look at the spring, we had a certain number of deaths. We had a certain number of cases. And when we look at the ratio currently, well, there are fewer deaths per case. And I would say that the main difference between this fall and the spring is that there are way fewer deaths in the CHSLDs. I admit that I don't have the numbers in front of me to know if in the rest of society it's comparable. Is it more or less in the spring? We would have to see. But what I'm seeing is a great improvement in CHSLDs. But for those who are at home, I don't know. Do we have, all things being equal, do we have more deaths in absolute numbers versus a number of cases? 2/3 of deaths in the first wave were people in CHSLDs or from CHSLDs, whereas now half of the deaths are people who are living at home. Well, it's possible that it's because there are fewer deaths in the CHSLDs that the proportion changes. I understand. But in absolute numbers, I don't know if there are more or less elsewhere. I'd like to talk about accountability and responsibility, themes that you have brought up quite a bit, especially when you were in the opposition. The CEO of the CIUS in Lanaudière is saying that he's never heard any complaints as to the treatment of Aboriginals at the Joliette Hospital. And actually, he said that he didn't look at the report of the commission, and he says nobody mentioned to him the problems that were mentioned during the public commission. So he's putting this on a previous employer. This man, he's still the man of the situation as the head of a CIUS like Lanaudière. I'm going to let Christian answer, but I want to tell you that it bothers me to hear this. When we're talking about accountability, it bothers me to hear an answer such as this one. Now, we'll go drill down. We'll go look at the file. The Minister of Health is looking at this. Yes. What worries me much more right now, and I think this will answer your question in part, and I mentioned this, I talked with Yann Lafrenière over the past few days, it's to reestablish a relationship of trust between the Atikamekw community, especially at the Joliette Hospital, and the management of the establishment. This relationship of trust is completely broken. And the population, the Atikamekw population, has no trust. So for me, the main important file, the priority with Yann Lafrenière, is to try to reestablish this relationship of trust. We are acting in a very concrete manner right now. We have started to work on training. We have looked at what could be done, specifically what we can do for the Cité des Autochtones. There were some things that were being done that we want to accelerate. I have met Mr. Lafrenière at least 3 times over the past few weeks. So we are very active. They were very clear that they had lost trust in management. So this will be part of the elements that we will take into account over the next few days. But once again, I'm repeating myself, it's through our actions. And there's a plan that was developed by the current CEO. His challenge will be to execute, but I want to analyze to see if he can implement the plan, if he can execute, and secondly, will we be able to reestablish this relationship of trust between the management of the institution? You're meeting him? I'm trying to understand the measures exactly with the CEO. Is there a specific measure, or, well, what we're going to do? Well, listen, we heard his declarations over the past few days, so I think that I'm repeating myself here. We have to look at the facts. Over the past few days, there were some statements that were made from both sides, right? This ex-employee and the CEO. I heard as well some comments from the Atikamekw chiefs. So with Yann Lafrenière, we are bringing all of these elements together, and I'm repeating myself again, we must make sure that we have the right people to regain the trust of the community. Question? I want to know, concerning the rapid tests, why is it taking so long to find out how to use them? I understand that we want to use them correctly. There are some precautions to be taken, but at the same time, the process itself is not as quick as it should be. Well, you know me, things never go fast enough for me, but I would like to... I asked a lot of questions because we have to understand what is the context, and I'm going to take a moment to answer. For me, there are 3 components to my answer. First of all, we had to have the tests, right? We knew that they were coming. There are 2 types of tests, but we also have to have the equipment that goes with the tests, because the tests, these rapid tests, are not processed with the same equipment. Some are done with the same equipment, but there are others where we need special equipment. These tests, we're getting some this week, and we'll get more in the next few weeks. The conditions under which these tests work, and that's my second point. So we had to get the tests. The conditions under which they will work are very different. I'll give you an example. Because they are not as precise as the more sophisticated tests that we do now. So the viral load must be much higher. So we can't take them to do any type of testing like we're doing now. This is a very important element. These tests, however, the advantage is that they can be done very quickly, and we can get an answer very quickly. So when we understand that, we have asked a committee of experts led by a doctor. He told us, here are the conditions, the winning conditions to use this test while we're waiting for them, and now here is where we will send them. So we are ready to do this, but we needed to have them in hand. Now, the winning conditions, for example, let's take the example of an emergency. When we have to do the triage for somebody who's symptomatic, so the viral load is significant, but now instead of waiting for the famous 24 to 48 hours, these are low-volume tests. We can do it directly at the emergency. And that's why it's a bit more complicated than just saying, we get the test and we put it in the machine. It's very different. So the conditions are different, the applications are different, because we'll be able to give them in different settings. And the best example for the application is in the Aboriginal community, where the volumes are very low. We are far from screening centers. So you see the whole mechanics behind that. So what I've asked the ministry to do is to create a deployment strategy now that the tests are arriving, now that the equipment is there, to make sure that we maximize the complementarity of the tests. You know, we do 25 to 30,000 tests a day in a conventional manner. Now with the tests that we have received, we'll begin with 500 a day, 1,000 a day, 2,000 a day, and we're going to try to find the best way to test the right patient in the right place, how these tests. We'll have around 200,000 of them, so perhaps we can go up to 5,000 a day. But you'll see that it's not that easy to decide. But we are ready. We have made the right decisions. We understand the equipment that we need. We ordered the equipment that's required, and now we will have a deployment strategy that will begin next week. My second question is for Mr. Legault. It's a question from my colleagues from Radio-Canada Quebec who want to know, the Trudeau government, I'm going to read it, the Trudeau government is accusing you of doing politics on the back of the environment by asking for the acceleration of the project for the Port of Quebec. They say that you should concentrate on the tramway file. Listen, there is a project that is very important in Quebec, and we are talking about 1,200 jobs, well-paid jobs during the construction phase, and afterwards 1,000 well-paying jobs during the operation. So we're talking about a lease of 60 years. What we understand, because the Minister of the Economy sent a letter to his counterpart in Ottawa on the 9th of June, 2020, we still haven't gotten an answer. There seems to be an issue because supposedly the Hutchinson company is a Chinese company. However, the owner, the main owner, is a Canadian resident. And we haven't gotten an answer from Ottawa. We've been waiting since June 9th. 1,000 jobs at more than $60,000 a year. We would like to have an answer. Mr. Duclos said certain things as it relates to the Chinese control of the company, but the problem seems to be there. There's a problem as well, or there was a problem with the fish stocks, but Pierre Dufour has said that he will no longer make these recommendations because he believes that it is no longer a disappearing species or an endangered species. So the federal government, is it ready to accept this investment? And we're waiting for an answer from Ottawa. Question? Was there a national directive so that the directors of public health stop calling the contacts of cases who are at moderate risk and that they're giving that task to the cases themselves? We have no national directive. There were some discussions between the directors, given their capacity to do tracing. This is a strategy that was used elsewhere, even elsewhere in Canada, and which was discussed. But what I want to tell you is that since then, we are increasing the capacity for our investigations. We have doubled our capacity. We're in a process now to increase it, to come back to do contact tracing directly. Do you still have a recruiting campaign? We've been talking about contact tracing since May. How come we're still trying to fill the gaps? Well, because in this spring, we had a lot of resources. There were professional resources, for example, students in medicine, all sorts of resources who were present, who came from Je Contribue as well. These people have gone back to work or to school, and now we are training other people for the contact tracing. As I said, during the first wave, there were a lot of outbreaks in the CHSLDs. Each case brought about 2 or 3 contacts so we could control an environment, whereas we found ourselves in situations with outbreaks where for one person we could have 70 contacts. So it requires even more people. The other element as well is that people are working right now 7 days a week often, and what we want to be able to do, we want to allow them to come back to a more normal life, especially if we see a lot of cases. We're always recruiting. How many people are you missing? Well, we went from 800 to close to 1,600. Personally, in terms of capacity, potential capacity, I'd like us to go up to around 3,000. Even if we don't use these people, we will have a pool of trained workers. When I put out numbers like that, I have to be careful. But when I look at what's happening elsewhere in other countries, I just tell myself that we must get ready in advance, if possible. But I'm sure that you're going to ask me the question in 2 months if we're at 3,000. But still, I think we have to increase our capacity so that we can also let people rest because they're working night and day often. Thank you. Duly noted. Question? Mr. Premier, Health Minister. Mr. Legault, you brought up the situation in France earlier. You saw that yesterday Mr. Macron opted for some significant measures to close down the economy as of tomorrow. You have a new 30-day window, and you said if in 15 days things are not improving, we'll see, or if it improves, perhaps we'll reopen certain things. If things do not improve, if in 15 days we're still at 1,000 cases per day, are you considering other measures, more restrictive measures in Quebec, kind of like what we had in the spring? Are you thinking of closing down certain parts of the economy over the short and medium term? In other words, do you have means, more severe means, to try to control the situation? I can start by telling you I'm not an expert, but there are two things that I would like to mention to you and to Quebecers, and especially since we're heading into November. We have to think about the changes in temperature, and I think that the month of November is very important to test what is going to happen this winter. I had the opportunity this week to speak to the Minister of Health in France, who is going through a very difficult period. And he explained to me, we were talking about our different measures, we were comparing notes, but what he was telling me to be very careful with is a change in temperature. Because a change in temperature is not its impact on the virus, and I want to be careful. I'm not an expert in this, but what we're realizing is that with the cold weather, people obviously are no longer outside on a terrace, they go indoors. And when we go indoors, the air is drier. Restaurants, but even homes, are not as well ventilated. The virus has a tendency to spread much more easily, from what I understand. Dr. Rita explained this to me, and Dr. Massé. The virus spreads much more easily in a dry environment. So what we're seeing in Europe right now, there's a link with the temperature. So I am telling you, and we discussed this, I think that the month of November will be a great test for us. We have this change in temperature. Yesterday, it was snowing in Quebec. We were all a bit surprised. So I think that to answer your question, I would tell you that we've got to test. Before we start thinking about changing measures, how will we continue to control this wave so that we don't experience what Europe is experiencing? And if we can, in November, not only control, but to decrease the number of cases and to create this wiggle room that we need, well, I think that we will succeed. But I'm telling you that the month of November, the change in temperature, the fact that people will be indoors more often, this is really a great test for Quebecers in the next few weeks. Now, according to what you just explained, this change in temperature with a virus that can spread more easily in these conditions, well, is it not unrealistic to think that we can improve the situation, whereas, as you just explained, the temperature, the cold temperature, will make it so that there will be more people indoors? So I'm trying to reconcile the two. How can you think that things will improve, whereas you think there will be greater risk for people because they will be indoors? I will let Dr. Arruda add to this, but I would tell you one thing. there is an environment with public health measures that will help us to win. Because when people respect the principles, social distancing, when they go indoors, when we don't have any significant contacts, when we are able to say that we are keeping our mask on, because we do have some places where we tell people, well, you can go to work, you can go to school. That's what you're talking about here. How will we respect the social distancing measures when there will be even more people indoors? But these measures, we must respect them. So I think that both are compatible. But that is why we are insisting so much that people respect social distancing measures, because when we go indoors, it's easier to let down our guard. It's easier to be together. And I'll give you an example quickly. In health, we've got workers right now, and I'm going to talk with the union soon, but and I've repeated this often, where we have outbreaks right now is because people don't go outside to take a walk. They will take their break together amongst employees indoors, and it's going to be dry for the reasons that I've explained. So that is where the public health measures must be applied, and that we will ask our employees, especially in health, to be very careful. And we will have these discussions with the unions so that they can help us in our communications with employees. We'll go to the English questions now.
I'm just going to follow up on that, actually. So from what you're saying, it sounds like November could be a test for Quebecers, but certainly November is really the start of the cold weather. So I guess what you're saying is you can expect these measures to continue throughout the winter into warmer times, but can you outline some of the dangers about being inside specifically in wintertime?
Dr. Arruda, you want to give some example?
Yes, in fact, you know that being when you get outside, there is air, there is less probability you're going to be 2 meters together, under 2 meters. When you get inside of houses, if you do parties inside, the risk of getting on less than 2 meters, the risk of contaminating ourselves is there. And also in winter, we heat the house, the air is more less humid, and with less humidity, the projections will go further than if there is high humidity that will bring the gouttelette downstairs. So what is important is that to make sure that in this period we don't try to overcrowd houses. It's why we don't want people to meet and have parties actually, because then the risk is very high. That's have been, I think, you know, even outside with the barbecue this summer, we had people who get infected. So imagine if you put that person's inside of the house, the risk is higher. And as any other infectious disease from respiratory, winter time is a bigger spread of infections. That's true for those viruses, and it's also true for the gastro ones. We see each Christmas big epidemics of those kinds of viruses.
My second question is for Mr. Legault. In the past day, you retweeted 2 tweets that suggested that Ontario might be underreporting its deaths based on data about cremations in Ontario. Mm-hmm. What message are you trying to send? Do you think Ontario is underreporting its deaths?
What I see is that we have to be prudent. I don't like at all to hear Mrs. Anglade every day saying Quebec was the worst place in the world for the first wave, and Quebec is the worst place in the world for the second wave. First, we have to look at what's happening in the United States, in Europe, not only in the rest of Canada. Second, I've read this report. What this report is showing is that until June the 30th, when you look at the cremations, okay, we know that about 70% of the people are getting cremation, that when you compare the number of deaths with the average of the preceding 3 years, there's a lot more death than what was reported for death of COVID-19. So I'm just saying, be prudent. be prudent.
But do you
I'm
doubt?
very anxious to see the real figures about over mortality because, and I'm asking that about every week to those two guys, did you get some information from Ontario about over death? So far, we don't have that, but we have this study about cremations showing that there were few thousand deaths more than what was reported.
So do you doubt Ontario's numbers?
I'm just saying, be prudent. Before, when I hear every day Mrs. Anglade saying like it's a proof and it's certain that we were worse than other places, I just say to Mrs. Anglade, be careful, be careful. Wait.
I may add something. It's well known that when you want to compare death rates in between countries, in between provinces, even if we have systems of detecting it, you know, the definition of case, some doctors will associate the disease first, as in Quebec, any time somebody, even if they die from a cancer or another disease, if they've got COVID-19, there's going to be count as COVID-19. That's not necessarily the case everywhere. And even if I give that orientation in Quebec compared to Ontario, in the field, things can be different. So when you want to compare different death rates, and it takes time because you die, the diagnosis can be changing. You know, it's not a pure diagnosis you get that day and that's finished. Sometimes you need to have an autopsy. Sometimes you need to have tests. The tests are negative, so it's not more a case. The only very good way to compare is to look at surmortality in a specific period. And that's true for France, that's true for, and the systems have not the same sensibility. Even if you get the same case definition, in fact, the sensibility or specificity can be very different for one place. And to be able to compare, because we cannot make sure that those differences are what they are, we are looking for surmortality. And what I'm saying that we're going to see, perhaps Quebec has more, but perhaps the level more is less than what we think, because we have it's like we do that for, I would say, heat waves in summer, okay? Some provinces wait to have the report of coroner, and we, as soon as there is a death in those periods, we calculate it as a heat wave symptoms. So you're going to see big numbers in Quebec compared to other provinces. I'm not telling that it's not true, but that's the way. And you will see those data being published in the next months.
And I would add that maybe, in a way, the difference is coming from Quebec, because and we've discussed that last spring, and I remember it was a long time ago when I was Minister of Health. Quebec has the reputation of putting more than less. It's true for all sickness. I remember a study about the death following the fact that the weather was too hot. We are very fast to say, oh, it's because of that. And I think it's correct, but we are, comment on dit ça, plus catholique que le pape. More Catholic than the Pope in Quebec, and we have this reputation since many, many years, because I'm talking about when I was Minister of Healthcare.
And in fact, it's because we want to intervene, even if it's not a real case. If there is a risk that it's a one case, we then can intervene. You know, it's why we use that way, because we don't do those vigilance systems for statistics or to be compared. We do that because we want to intervene where there is a problem.
Merci. Cathy Sonnet, CBC.
Good afternoon to all of you. Mr. Legault, I was surprised to hear your decision regarding Mr. Fitzgibbon and the Ethics Commissioner's report recommendation for this sanction so quickly. So basically, you know exactly Mr. Fitzgibbon is a businessman, you understand totally. his own approach, but then you're saying to your own caucus, to your own team, the ethics commissioner, this institution is more important.
Is what?
Is more important in a sense. You cannot break the rule.
Of course, you know how important it is for me, the ethic. You must remember that when I was in the opposition, I threw out two guys, two MNAs out of the caucus because I was not happy of their ethic behavior. So I had the report at about 8:30 last night, and I was very mad. And but I think that the explanation I got is that our Minister of Economy, he wants to get as many projects as he can, all right? So receiving projects from a friend, he said, I will study the project like if it wasn't coming from a friend. And in fact, what happened is that between the three projects, two of them were refused, and the only one that was accepted was about a municipality, and it was accepted by another minister. So I think the intention, he did it in good faith, but you cannot meet a friend who wants to present you some projects before all the requests we get every day. But it's a question also of experience.
Okay. And my second question is, a colleague is working on this Montreal area teacher that had to take an unpaid sabbatical to care for her 7-year-old who is doing distance learning because she has a heart condition and she's immunocompromised. So we hear you talking about teleworking. We're just wondering how come the government is not pushing more for teachers to basically do that type of teleworking when they do have this type of situation at home, because now she has to take a sabbatical, unpaid sabbatical.
Okay, first, you understand that we don't have extra teachers that many in Quebec. In fact, it's the opposite. We have a shortage of teachers right now. So we have to choose. Do we want them to be in the classrooms or not? And we choose to put them in classrooms. Of course, we have about 1,000 classrooms that are closed. So these teachers, they have to teach with new ways to doing that. For secondary 3, 4, 5, it's 1 day out of 2. So they have to use, and that's why yesterday we decided to give 3 days of training to the teachers in order that they be better trained using not only Teams and Zoom, but also having exchanges with students that are at home. So, but we cannot and we don't want teachers to choose first to do video teaching. We prefer that our children be in the classrooms.
Thank you. Merci.
Philippe Autier, de Gazette.
Good afternoon, good day. A little question for Dr. Arruda. If you could elaborate on your comments on when a possible vaccine would be here. You're saying January or February, we might have a vaccine in Quebec and Canada, and where would that vaccine be coming from?
First of all, there is, it's always hypothesis from what I heard from the different information we get. There is vaccines that are being produced in contracts with the Canadian, because the vaccine is going to be shared by provinces from contracts that are going to be made by the federal level. There is some different contracts. I don't have the specific information of which company is going to give it, because that's confidential information for different purposes. But they project us that at the beginning of the winter, January, February, or March, there's going to be some doses that will be available in Canada. But we understand that it doesn't mean that we can vaccinate in 1 month all the population, because the doses are not going to be there for everybody. We will go with nationally and I would say provincially also deciding which people will receive those first doses, the ones for which it's going to be secure, the ones for which it's going to be effective. And it's clear that probably, as on other programs we did before, healthcare workers and high-risk people will receive the vaccine first.
Okay, thank you. And for Minister Dubé, last week we were talking that most of the new cases that were being detected, I think you said 46% were in the workplace. Today, after 3-4 more weeks of lockdown, what is driving new contaminations? Where is it moving?
First, I would like Dr. Arruda to make a precision, because last week what was said was the number of outbreaks versus the number of cases. The statistic that was given, Mr. Gauthier, is that there were roughly 45-46% of outbreaks being in the workplace, but they generate, and I'll give you a percentage that Dr. Arruda can confirm, can be in a range of 15 to 20% of cases, because the outbreaks in the workplace generate less cases sometimes. So the proportion of outbreaks versus cases can be quite different, but maybe Dr. Arruda can just give you some more information on that.
That's the case. You can have more outbreaks, but with less cases. In fact, there is more outbreaks because there is more industries and everything. So it's 48% of the outbreaks, but they generate 12% of the cases. The place where we have more cases are still, I would say, in long-term care facilities and CHSLDs. It's 19%. And if we look at the different places, it's in industry, manufacturing, commerce de détail, big commerce. That's all kinds, in all kinds of sectors of activities, there is some outbreaks. It's clear, like in the abattoir, there is places where there is conditions where there is big outbreaks. That's well known. But some outbreaks will have only 2 cases, 3 cases, but they are diffuse in all the sectors of activity. Anywhere open to the society, open to the community transmission can have cases, but most of the times they are well controlled by teams of public health and SNEST. They are taken into control.
And I just add one point on that. This is important, and we're working really hard on that. When we give you those percentage, I think we need to realize that we should give you a range, and I think we'll go over the next few days, and I committed to that we'll give more information on the number of outbreaks and the number of cases that were originated. Because as you know, when we test and when we trace, we're never sure that that person, where it has been contacted really, because they can say, well, I was in this restaurant, or I was at work, but you never know exactly where that person. So I would just take, and this is, I know this is maybe frustrating, but we cannot be precise we can be precise the number of outbreaks, but when we split them into cases and by milieu or by sector, this is where we should give you ranges, and that's what we'll do over the next few weeks, just to give you more information.
You can have cases, outbreaks, you've got cases, and then you've got contacts. There is places when you only have 3 contacts, it's easy to control. But when there is places where you had 100 contacts, you know what makes the difference? So cases, outbreaks, cases, and the contacts that we must contact to make sure and test or if it's significant.
Les 2 dernières questions de la conférence de presse. Raquel Fletcher, Global.
Good afternoon. I have a question about people not getting tested in, certain marginalized neighborhoods, for instance, because they don't want to miss work. And this is still an issue that the federal government has, said that they're going to do something about, but it seems to still be an issue in some neighborhoods. Are you concerned about this, or how do you explain this?
I just want to make sure I understand your question. Are you talking about in the health system or population in general? I just want to, because that's different dealing with our employees being tested or in general.
No, I just mean in general, people aren't getting tested because they don't want to miss work and they don't want to lose it.
Well,
We've been talking about this for a long time, so that's why I'm wondering why there hasn't been some solution yet.
Well, I think, and I'll leave that, but we've been very clear that somebody that want to get tested, that should not be a reason for dismissal at work at all. So if people cannot get or don't have the breaks from the employer to make sure they get tested and act accordingly, they should tell us, because I mean we said all the time that the health was more important than the work. To be clear.
My next question is also about the letter from the 700 doctors, and I wanted to know what your reaction was to that when you read that, and what needs to be changed.
Well, I was very clear that I was not surprised, because what the doctors are saying is the reform that was done by Dr. Barrette has been a reform of centralization, and I don't think that's the appropriate way to deal with local authorities in some cases. We have proven with the decision that we have made in CHSLD that we wanted to have local management that can be imputable, it can be responsible. What the doctors are asking is a bit different, but they want also, they say that they cannot have the decision sometimes that they could do. It's a bit more complicated because you're not dealing with only one CHSLD, but you're dealing with different departments, you're dealing with an institution that is a lot more complex. But I said clearly that I will take note of their report. I haven't read the report that they're talking about. I'll read it. But if there is a philosophy of us, it's clear. Imputability needs to go with also with responsibility. So if they want to be more imputable, they need to be more responsible.
Accountable?
I'm sorry?
Accountable?
Accountable, thank you. And that's what we've done with CHSLD, and we have a good example of what happened in Montérégie this morning.
And I would add that even in the private sector, this approach of decentralization in exchange of accountability is better seen by the best managers. So it's not only in public sector. And I like the word accountable. It's even better. We don't have the equivalent in French. But I like people to be accountable. Too accountable.
Too accountable.
Merci tout le monde.
Merci.
Soyez prudents.